Hi, this is Dr. Desmond, and today we're going to talk about breast augmentation. Now, there are three keys to getting a great result with breast augmentation surgery. The first is preoperative planning. The second is the day of surgery and what your surgeon does on the day of surgery with operative technique and things related to the surgery. And the third thing is the postoperative recovery plan. In other videos, we've gone over the postoperative recovery plan and the preoperative planning. Today we're going to focus on the day of surgery and the operative technique. Now, there are multiple studies that have shown that there are 14 specific things that your doctor can do to help improve your outcome and get a better result from surgery. And we're going to go over that 14-point plan today. And you can find your doctor who ascribes to this 14-point plan on a website called saferbreastimplants.org. They have a doctor lookups feature there, and you can use that to find somebody in your area who follows these principles. So let's get into the 14 points now. So before we get into the 14-point plan, I want to talk about one of the long-term complications of breast augmentation surgery, and that's called capsular contracture. Now, every time we put a breast implant in, or any foreign material into your body for that matter, your body walls that foreign material off with scar tissue. Now, that scar tissue around the breast implant is called the capsule. And normally, that scar tissue that sits around the breast implant is very thin, it's essentially translucent, and it's soft, and you can't really tell that it's there. But in some patients, after surgery, that scar tissue, that capsule, can get firm, it can get hard, and it can distort the breast, and it can even be painful, and that would require further surgery. And that condition is called capsular contracture. And the 14-point plan does two things. It decreases the incidence of capsular contracture and also makes your recovery in the short term from the surgery a lot easier. So the focus of the 14-point plan is to decrease bacterial contamination and bacterial contact with the implant and the surgical site, because studies have shown that by decreasing the bacterial contact and contamination, we decrease the long-term complications, decrease capsular contracture rates, and improve long-term outcomes. So the first point of the 14-point plan is simply to have your IV antibiotics within 15 minutes of the incision for your surgery. So the next point in the 14-point plan also happens right before the incision starts for surgery. And what we need to do is to actually cover the nipple areolar complex to prevent any bacteria coming out of the milk ducts, because if they come out of the milk ducts, they could potentially come into contact with the implant. So we want to put some type of nipple shield or covering over the nipple areolar complex to prevent any of the bacteria coming out during the operation. And that should be done right before the incision is made. So the fourth point in the 14-point plan has to do with the placement of the breast implant itself. And you can position the implant above the muscle, you can position the implant below the muscle, or you can position the implant partially below the muscle, which is also called dual plane. And dual plane is the most common position for the implant because it gives some of the best results. Now, there are specific reasons why you would want the implant above the muscle, and there's some specific reasons why you would want the implant completely covered by muscle, but most of the time, the best option for most patients is dual plane. And the reason we call it dual plane is that the pectoralis muscle comes down across the chest like this, and the implant is centered on your breast, underneath your breast tissue, on the chest wall. And so the outer part of the implant and the bottom part of the implant are not covered by the muscle, but the upper portion of the implant is covered by the muscle, and that's called dual plane. And again, that gives you the best long-term results and the lowest capsular contracture rates. So points 5, 6, and 7 of the 14-point plan all have to do with specifics of the operative technique. And those specifics involve being very gentle with the tissues, not to cut into the breast tissue itself, because again, we don't want any of the bacteria coming into the space where the implant will be, and using meticulous technique to control bleeding or hemostasis. So the next point of the 14-point plan, once again, involves antibiotics and bacteria. So what we want to do is wash out the space where we're going to put the implant into with antibiotic solution to decrease the risk of capsular contracture. So the next 4 points of the 14-point plan have to do with actually putting the implant into the pocket or the space that's been created for the implant. So what the surgeon needs to do is change their gloves, rinse out the pocket with an antibiotic irrigation or an antibiotic solution, and decrease the amount of time from opening the implant from the sterile box that it's in to the time that it actually goes into your body. And then by putting the implant into your body, you want to decrease the contact with your tissues and even handling it. So there are some surgeons who use something called the funnel to actually help squeeze the implant into the pocket without ever touching it. And there are other things you can do, like cleaning off the skin around the incision right before you put the implant in, again, to decrease the risk of bacteria coming in contact with the implant. So the next 2 points of the 14-point plan involve trying not to use a drain tube at the time of surgery. Now, in reconstructive breast surgery, frequently we do need to use drain tubes, but for cosmetic breast augmentation, it's very rare that we need to use drain tubes, and you really don't need to use pain pumps, which provide an opportunity for bacteria to come through the skin from the outside in towards the implant and potentially increase your risk for capsular contracture. And finally, the last part of the surgical technique that's really important to create a barrier for any bacteria is to have 3 layers of closure between the implant and the top of the skin in order to protect the implant from bacteria. And so the final point in the 14-point plan is actually, in the long term, to take antibiotics with any procedure that pierces your skin, or if you have any dental work. So that's kind of like if you have mitral valve prolapse, you're supposed to take antibiotics. Same thing if you have breast implants, you should also take antibiotics anytime you have a procedure done. So I hope you enjoyed this video. Thanks a lot for watching. Please like and share this with a friend so that they can find out the best way to get a great long-term outcome with a breast augmentation procedure.